to the Fall Perinatal Professionals Networking Night that Birth hosts in the spring and fall. We wanted to be able to share the stories today or tonight of 3 people in our community that have been thinking big picture and connecting dots and thinking systemically about how to care for perinatal families, not just clinically and not just non-clinically, but in a coordinated way through public policy and legislation. The reason we started thinking like this is this past June, the Birth staff attended the Perinatal Quality Collaborative conference in Augusta. And some states do and some states don't have what's called a PQC, a Perinatal Quality Collaborative. One of our biggest takeaways from this conference was that the level of collaboration and cooperation between sort of 4 sectors of society was not as robust as we need it to be, and that in order to move forward, we need the healthcare system, community organizations, Birth is an example of that, perinatal professionals, doulas, for example, as well as the legislators or the legislative process to work together in a way that they're currently not. They're kind of siloed. And this sort of feeds into a mindset that most of us and most of the families that we will work with, whether we realize it or not, are very individual focused. We live in a culture in the US where individualism is the way we think about things. So we actually struggle to think systemically and to solve problems systemically. And how this impacts perinatal families is there's a narrative of personal failure that crops up when you aren't able to see your individual struggles as part of a larger context. And so to move into sort of culturally and sort of get rid of these outdated narratives of the individual as the problem and personal failure when you struggle as a parent, I wanted to hear from 3 people tonight. One is Brenda Emerson, who is a certified professional midwife with Sacopee Midwives. Another is Sarah Tewhey, who is an acupuncturist and a doula with the Maine Doula Collaborative. Nope, the Maine Doula Coalition. And also Evie Woodlinn, who is a lawyer with Bernstein, Shur. So first, let's hear from Brenda about a new initiative that she's starting called the Postpartum Project. Brenda, tell me about the idea behind this. What were your observations that led you to get this going?
Hi, thanks for having me. So over the last 30 years of being a midwife in the rural community and in the Portland area, we've just seen the need for postpartum support for families is important and not getting met. And we've tried to meet that in our way, but have been totally overwhelmed with trying to do that. And we've also realized that there's a few other projects out there, but we're looking for family directed in-home care, so that the families are choosing their care and having it being culturally appropriate. And we understand that the financial means was a stress for most everyone. And so we started a nonprofit in 2022. Originally that was going to encompass our entire business, but the more we looked at it, we realized we just need to focus on the postpartum project. So we have, let's see, we're hoping that in doing this, that folks can hire their own doula postpartum for 6 4-hour sessions that can go over the 6 months to a year after a birth or an adoption of a child into the home. And we're hoping to be able to fund this through care credits. So we've been applying for grants and trying to do some fundraising. And we're going to have a pilot project in January with just a couple of people. Hopefully we'll have more funding soon. Um,
If this was well funded, what would be different for families if this had the resources that it needed to be effective? What would you see would be different from your eyes?
we have a community focus group that has been meeting to discuss all the ins and outs, what's going to be best for these families in rural areas. We're concentrating on the Oxford and York County rural areas at this time because there's really not a lot out here. And there's the smaller hospitals are closing. People are having to go farther for any kind of care at all. Actually, there's no there's the smaller hospital, Bridgeton, that's out this way, has closed to birth. So everyone has to go to Memorial in New Hampshire or to all the way to Portland. So you're talking about up to an hour drive for some people. So we're seeing a real lack of coordinated care postpartum. And hopefully if we get funded well, families will be able to hire a doula of their choice to come in and provide logistical help. That includes light housekeeping, laundry, help with any feeding problems for the baby, and referrals to practitioners, and having a list of referrals to psychiatric nurse practitioners, midwives, OBs, and other folks that can help them postpartum.
And what kind of a difference does this make for individual families who might not otherwise have access to this postpartum help? What difference does it make in their lives?
And the support will be incredible for them. I mean, lowering the cases of postpartum depression, postpartum psychosis, suicide, violence in the home, domestic violence in the home. I think it will be incredible if we can get this going. Especially if it's family directed. I really feel strongly about that.
I'm so glad to hear of this project of you being able to think about a very specific population. I think those of us who live in Greater Cumberland County might not have this picture of lack of support and community that isn't happening in some of the other counties in Maine. So really being able to invest time and energy and resources into those outlying communities is such an important project. Brenda, thank you.
Thank you. Thanks for listening.
Yeah. Sarah, tell us about the Maine Doula Coalition. What got it started? What problem is it trying to address? What's been happening? How long has it been doing what it does?
Sure. Thank you, Leah, for inviting me to be here today. I really appreciate it. So the Maine Doula Coalition was initiated late in 2022. There was no real organizing body for doulas at all in Maine. The intention was to help Maine kind of join the ranks of a lot of the other states that are working to expand and better integrate doula access into the healthcare system. So our mission is to expand access to doula services by reducing financial logistic and cultural barriers to doula care to pregnant and postpartum people in Maine. So we're a very small organization. We're comprised of a really small group of doulas and also a few healthcare providers. We're all volunteer-based at this point in time. We are doula-led. And we've built relationships with a lot of different groups in the state whose missions intersect with ours to improve perinatal health outcomes in Maine. Our partners are doulas, healthcare providers, public health officials, social service groups, community organizations, and also state agencies that we've built relationships with over the course of the last year. So the hope is that we're going to be able to sort of support a doula workforce that's both diverse and also sustainable, and do that through policy change, community building, public health education, things like that. So to clarify, I think sometimes people get confused. We're not a training organization. We're not a doula agency. We're not hooking up doulas with families. The core function is really to represent the doula workforce in the state. So we have a lot of different initiatives that we are working on. Two of the main ones that I think are relevant to this group is this idea of giving doulas a voice and representation at statewide agencies and in statewide groups. So prior to the Maine Doula Coalition, there was no professional organization representing doulas in the state. So there was no way for public health individuals, social service groups, state agencies to interact with one group that was representing doulas. So after about 18 months, we're currently maintaining relationships with about 35 to 40 different community organizations, community groups, social service groups, healthcare providers, and also state agencies like Maternal Child Health at Maine CDC and Office of Maine Care. So we've also been participating in statewide advisory groups over the last 12 months, and that's been really key to improving collaboration with perinatal systems of care, and also providing a lot of education on doula services to those groups. And that also ensures that the doulas in Maine are actually at the table and have a voice in these places where perinatal healthcare decisions are being made statewide. So those groups include the Perinatal Systems of Care Working Group, which is a group formed by Maternal Child Health at DHHS, the Maternal Health Task Force, which is a federally funded initiative from Maine Health and the Maine CDC, the Perinatal Quality Collaborative for Maine, which Leah spoke about a little bit earlier. We're representatives at those meetings. We have a doula who's on the FEMR, which is the Maternal, Fetal, and Infant Mortality Review Commission. And then we also have a presence on the Maine RMOMS cohort, which is the Rural Maternity and Obstetric Management Strategies group. So there's now, where there weren't doulas at a lot of these groups before, so there's now doula representation at all of these meetings.
And that's just in the last 18 months?
That's really in the last year that we've been at all of those groups. And the other thing that we're working on is the expanded doula services into Maine Care or Medicaid. So we all know that Maine Care coverage of doulas has the potential to really improve outcomes by providing doula services to the populations that are at the highest risk of adverse outcomes. So we are looking at expanding doula services into Maine Care, and that includes labor and birth services and also services that are exclusively postpartum. We have a really widespread support for this across most of the perinatal health groups in the state. So the hope is that we're going to have Maine Care coverage, and hopefully private insurance will follow that over the next 2 to 3 years. There's a couple of different avenues that could happen, one of which is through legislation. Different states have done different things to get that policy enacted, and so we are partnered with the Maine Women's Lobby and some other groups to explore different avenues for systems change. And then the Office of Maine Care recently applied for a $17 million Transforming Maternal Health Care grant, the TEMA grant, which some people may have heard of, which is a federally funded program that focuses on expansion of midwifery birth centers and doula services and integration with community organizations. So Maine has applied for this. 15 states are going to get it. And if Maine gets that grant, then the grant mandates that Maine Care would cover doula services within the first 3 years of the grant. So that's another avenue that doula services could potentially be covered by Office of Maine Care. And we at the Maine Doula Coalition partnered with Office of Maine Care as they were applying for that grant to provide some advising on best practices for what Maine Care coverage might look like. So that's a tiny nutshell of what we've been up to with the Doula
This is
Coalition.
such a beautiful illustration of that level of collaboration and coordination that it takes to provide systemic public policy level support of a safety net. And if doulas listening to this are interested in getting involved, how would you recommend they reach out to you?
Yeah, I would recommend going to the website, which is mainedoulacoalition.org, and signing up for the newsletter. And if you want to email and let us know specifically that you're a doula, we have a newsletter that comes out as we have time to write it every 4 to 8 weeks. Usually we get around to providing an update. There's about 150 people from across perinatal systems of care on that list. And we also have a separate list specifically for doulas, and we will periodically send out updates on what we're doing just for doulas. And also specific calls to action or things that we need help with. And we are going to be sending out what we're calling the Doula Opinions on Doula Policy survey through the month of October. So be looking for that, because we're asking very specific questions about what doulas in the state want to see for doula reimbursement policy.
This is a really profound evolution. I will admit that I took my own doula training in 1999 and was an active doula from the year 2000 to 2010. And nothing like this level of coordination, collaboration, and systemic thinking was happening at that time. And so to really see this come to life in the last 2 years is profound. And I hope people can appreciate the amount of time and energy and effort that goes into putting something like this together.
Thank you.
Thank you, Sarah. Evie, we would love to hear from you about many of us feel intimidated by the concept of public policy and legislation, and like it wasn't anything we ever got adequately oriented toward. And so we don't imagine ourselves or picture ourselves either influencing it or even giving testimony about it. So if you wouldn't mind giving us some real concrete examples of how specific legislation can change the lives of perinatal families, that would be incredible.
Yeah, absolutely, Leah, and thanks for having me. It's an honor. My name's Evie. My pronouns are either they, them, or she, her, and I'm an attorney at Bernstein, Shur in Portland. And I launched and I lead the firm's family formation practice. So in my work, I help individuals and couples navigate the legal process of both building and then protecting their families. So most commonly, that's through assisted reproductive technology. So through gamete donation agreements or gestational carrier agreements, or through second parent adoption. And our firm also, I should mention, has an amazing government relations practice. And so that's made up of attorneys and lobbyists, and we work with organizations, usually nonprofits, in helping pass legislation, including in the areas of family planning and family protection. So I can kind of briefly talk about three pieces of important legislation to families that recently became law, and then kind of from my own personal experience for all three, what that change looked like. So the first one, well, I'll list all three of them. They're confirmatory adoption. The second one is the paid family and medical leave. And then the third is insurance coverage for fertility treatments. So confirmatory adoption, this law went into effect in October 2023, and it essentially establishes a very streamlined process for Mainers who are already the parents of children that were born as a result of assisted reproductive technology to be able to obtain an adoption decree without going through the traditional formal adoption process. So parents would qualify under this law if there's no other competing parentage claim for a child. So some people ask, well, why is adoption necessary in Maine when a non-birthing parent, an example in a same-sex couple, is already on a birth certificate? And I think the difference is that an adoption decree is a legal confirmation of that parent-child relationship that has to be respected by other states, and it can't be revoked or undone. So other states, for example, those that are more hostile to LGBTQ plus families, they could take the position that they don't recognize a birth certificate as it's a state government issued document. So having a formal adoption decree adds another level of protection across the country, especially if you're traveling and something happens. Pertaining to an example of how that makes it easier, I carried a pregnancy and gave birth to our kiddo 7 months ago. Prior to confirmatory adoption, my spouse would have had to go through a really formal adoption proceeding in court to get an adoption decree. So that usually would involve an extensive court petition, potentially a home study, a background and criminal history check, possible social worker assessment, interview of the child if they're old enough, and then potentially a hearing before a judge to make an assessment as to whether she was to be granted the adoption decree. It can be really invasive and burdensome for a person who is already the parent of their child for all intents and purposes. And it's also really expensive because you need an attorney through that process. So now, even when parents are not married, they can submit a brief petition to the probate court in the county that they live. And then they just establish that the child was born from assisted reproductive technology, that the non-birthing parent is the other intended parent, and that no one else has some kind of claim to parentage. And you just submit a birth certificate, copy of your driver's licenses, a marriage certificate if you have one. There's no need for a hearing or anything like that. And it happens really quickly. I mean, we got my spouse's adoption decree in 4 days. So it just makes it so much easier for particularly same-sex couples. The second one is the paid family medical leave. So beginning in 2026, eligible workers, both in the private and public sector, and that includes full-time, part-time, temporary, seasonal employees, will all be entitled to 12 weeks of paid time off available for family or medical reasons, which includes the birth of a child. Maine's, I think, the 13th state to establish this type of budget and this type of program. The contributions begin in January 2025, so a year before, and they come from both employees and employers through payroll. So it's like a rate of 0.5 or 1% of somebody's wages that will go into this fund. And there's going to be a lot more guidance that's issued by the Department of Labor no later than January 2025. So there'll be some more information before those contributions begin, and then the law goes into effect. And I guess my personal example is that my firm was one of the earliest adopters of a really a longer leave policy for parents, both birthing and non-birthing parents, and no matter how a child came into your home. And we are given 16 weeks of paid parental leave. My spouse, on the other hand, does not have any paid parental leave. So in order to have that time home with our kid, her option was to take federal FMLA, which, it only requires unpaid leave and job security, but essentially was taking that leave unpaid. So paid leave in Maine, it really allows not only parents to bond with their newest family member, but also to recover, to get adjusted, frankly, just to survive. And it's a really important change. And then the last one is, and this is a little bit prior to the perinatal period, which I understand, but I think it's important to highlight for families, is the insurance mandate. So this went into effect in January 2024. And in the simplest terms, it ensures that insurance companies have to offer policies within the state of Maine that include fertility treatments in their coverage. So this is a really significant step forward for people that previously needed to have a diagnosis of infertility. So the legal definition of infertility in Maine now includes individuals or couples that have an increased risk of transmitting some kind of serious inheritable genetic or chromosomal abnormality to a child. Sorry, I want to make sure I have the language perfectly right. So I'm reading an individual unable to conceive as an individual or with a partner because the individual or couple does not have the necessary gametes for conception. So the biggest change is that now the definition of infertility covers single parents by choice and covers LGBTQ plus couples and individuals who were previously left out of coverage unless they had a medical diagnosis of infertility. And so the coverage not only covers diagnostic care, but for fertility treatment and fertility preservation. And I think again, going to the personal story, the average cost of a single round of IVF in the United States is $25,000. So that either makes it entirely prohibitive for folks to grow their families in this way, or it forces people to incur really significant amount of debt to obtain fertility treatment. And specific to single parents by choice or LGBTQ plus community members, previously, a lot of the policies, the language required that sperm had to come into contact with the uterus during 12 ovulation cycles without resulting in a pregnancy before some kind of fertility coverage could kick in. So for me, that would mean paying out of pocket 12 times for IUI, which could take 2 years or $6,000 to $12,000 just for IVF coverage to kick in. So mandating coverage really improves accessibility for all people. There is some question because right now the law leaves what the extent of coverage is up to insurance companies. So it's up to them to decide how much in terms of cost they cover. But I think that's hopefully a future legislative change that can happen. So sorry, that was a little long-winded, but I wanted to touch on
No, it's so important for all of us to get a glimpse inside of the difference that public policy makes when it doesn't exist, and then the difference that it makes when it does exist. And I feel so lucky to hear these three different stories and through these three different lenses, whether we're talking about the care that rural families are not receiving, the representation that doulas may or may not have in order to be able to provide services more accessibly, and the laws that are allowing families to form or are an obstacle to families forming. I think rather any of this information that people are listening to right now is brand new, or you heard just a little something about it and you really weren't sure what it meant. For me, in my work at Birth Roots, really starting to understand the work of the Perinatal Equality Collaborative last June, and then late this August when the US Surgeon General came out and said that the amount of stress of parents in the United States has just reached a catastrophic level. When you have 40% of parents saying that their level of overwhelm and their level of stress has become paralyzing, that this is something that we need, not only need to do something about, but we need to do it at that higher level of coordination and collaboration. If you have not yet checked out the Surgeon General's it's called Parents Under Pressure. And the major takeaway from the advisory is that we need a fundamental shift in how we value and prioritize the well-being of parents and caregivers. And that's the theme of tonight's panel, is that shift of how we prioritize and value that caregiving work that parents are doing, and that it's unique to the United States. There's no other comparable country where these kinds of public policies are failing quite the way they're failing in the United States. But there's so much reason for optimism just in hearing these three stories and that work that takes it up to that level of collaboration, coordination, and thinking systemically instead of blaming the individual or pathologizing the individual, that leads to that level of like self-blame and that personal failure narrative. And so hopefully something you heard tonight in this panel has shifted your thinking around strategy. And when we finish watching this, we'll have a chance to turn to each other and talk about what are some ways that you can get involved in these different strategies for thinking more collectively, more collaboratively, and more systemically about perinatal families' health and well-being. Thank you everyone so much for being willing to do this. Really appreciate it.